a minute to look at it, Raquel, sorry.
Okay.
I swear, I think these Zoom meetings, you can schedule them back to back, which is what everybody's been doing. Makes it really hard to find time to go to the bathroom, for crying out loud.
Or get breakfast or lunch. Yes, I totally agree with you. I know, it's like there should be an etiquette of meeting, 15 minutes leeway between. Yeah.
That would help.
I agree. Well, if you guys want to, let's go ahead and get started. My name is Melissa Hess, and I'm the Operations Director for the Benton Franklin Community Action Connections. Thank you, everybody, for joining us for our Benton Franklin Continuum of Care meeting. We'll start by going around and doing introductions. So I don't know exactly how to do this. Generally, we're around the table, so I guess unless Chelsea has any.
Melissa, this is Chelsea. I can run through the list to see, I can list off the names that I see that are attending currently, and then we can see who else is joined us.
Hey, that works perfectly for me. So thank you, Chelsea.
Great. You're welcome. So if I say your name, if you want to go ahead and just announce yourself or say here. I see Becky Cohn.
I'm here, Chelsea.
Hi, Becky. I see Carol.
Carol Moser, Greater Columbia ACH.
Great. Diane.
And it's Diane Halo with Greater Columbia ACH.
Ruben Peralta.
Yes, Ruben Peralta with Greater Columbia ACH.
Sam Wardell.
That's Sam Riddell with Greater Columbia ACH.
Wes.
This is Wes with Greater Columbia.
I see Ben Shearer.
Yeah, Ben Shearer, Pasco Fire Department.
I see I apologize if I mispronounced this, a Cherise.
Parents Warner, Hospital Mission. I also have Debbie Beyond the Lily here as well.
Ooh, you were a little muffled there. We could hardly hear you, but welcome, Cherise. Karina Thomas.
Hello, Karina with Communities and Schools.
Diana Young. Diana, if you're on mute, we can't hear you. All right, Jeffrey Adams.
Jeff Adams, City of Pasco.
Welcome. Joel Chavez.
Yes, Joel Chavez was Community Health Plan of Washington.
John Penny.
John Penny here with Special Services for Veteran Families.
Judith Campbell. Oh, Judith, you're on mute.
Sorry about that. Judy Campbell with Columbia Industries, Kennewick.
No worries. Thank you. Welcome. Kaylee Bear.
Justin, that's you. Your name is Kaylee Bear.
Okay. Kathy Jones. No, Kathy. Okay, we can't hear you if you're speaking.
She just posted a little chat saying she can only hear audio. She can't talk.
Okay. Katie Zorb. I see there.
Hi, Community Health Plan of Washington.
Welcome. Kirk Williamson. Oh, Kirk, you're on mute. Nope, can't hear. Oh, well, I know Kirk's there.
We can see
I
him.
think I can see him too. Sorry, Kirk, but we do see you. Kyle?
Hi, this is Kyle
Kyle?
Sullivan with Human Services for Benton and Franklin counties, and I also have Dina Horton and Mari Clark.
Fabulous. Laurel?
Hi, this is Laurel with Greater Columbia Accountable Community of Health.
Lauren?
Hi, this is Lauren Noble with Greater Columbia ACH.
Lona Hammer?
This is Lona. I'm with Kennewick Housing Authority.
Martine Sanchez?
Martin Sanchez, Greater Columbia ACH.
Rebecca Groves?
Hi, this is Becky with Consistent Care.
Hi there. And then if I have not called your name, please announce yourself. One at a time, hopefully. I see
Michelle
quite a few
Burton
callers.
with the City of Richland.
Anna Curtis from. Go ahead.
Bethany Hale from Lourdes.
Anna Curtis from Support Services for Veteran Families.
Alicia Piper at the City of Kennewick.
Sign up parent with St. Vincent de Paul and Pascal.
Betsy Metcalf on the phone. Hi, everybody.
Betsy.
Sarah Coburn with CBVC in Pasco.
All right. And I am Chelsea Chapman with Greater Columbia ACH. And if that's it, Melissa, I will hand it over back to you.
Perfect. Thank you, Chelsea. Also, I wanted to mention Judith Gidley is in the conference room with me, practicing social distancing, of course. So now that we've gone through introductions, new business. So if anybody has any new business to share, feel free to bring it up. One item of new business that I wanted to mention is Kyle and I have discussed with Carol Moser of Greater Columbia Accountable Communities of Health about coordinating with or bringing into our continuum the supportive housing committee that I call you guys GCASH, so bear with me. The GCASH is kind of put together and facilitated in regards to Catholic Family Services or charities coming in and wanting to put together that permanent supportive housing project in Pasco. It unfortunately didn't work out as well as we had all planned, but just seeing the passion and the voices that were brought to the table for that committee, we'd really like to see that as perhaps a subcommittee of our continuum of care, because it really aligns with what we're doing and things that we could work on as well. So if there's any feedback or suggestions in regards to that, I just wanted to put that out there. And Carol and Kyle, feel free to, if I didn't get anything in there, to chime in as well.
I think you summarized it pretty well, Melissa. I know from the very beginning when we started down this road in March of 2019, people were concerned that we would end up with a bifurcated committee between the COC and the supportive housing, since the missions really do align really well, and we didn't want to get separated with what the COC was doing. So I think this is an attempt to try to bridge, and it was an attempt to bridge that time between being under the COC and having a committee move forward with a possible funding application through Catholic Charities. So I'm glad we're finally bringing it under the COC, but I think we really need to establish regular meeting times and all that kind of stuff. So.
And one thing that I wanted to kind of add to that as well is that while that project didn't necessarily work out, that as a committee for permanent supportive housing, that there may still be other opportunities that are out there for us to do different things that are still working to meet our goal of assisting individuals that are experiencing chronic homelessness. Okay, so more details on that to come if I don't hear any more anything from the audience. So next we can move on, or is there any other new business that anybody wants to add?
So Melissa, could this is Carol again. Could we just get a little bit more clarification? I think with being under the COC, what that would mean for the subcommittee. I mean, would we have our own chairperson? Would we have our own meeting times? Would we meet only quarterly like the COC does? Could you give us some ideas of what that would look like?
So ideally for me, and this might be something that we discuss further with the already kind of established supportive housing committee to see what works for them. I personally would like to see it run absolutely working or seeing more frequently than quarterly. I think that sometimes there's a lot of work that we can miss out on doing if we only meet quarterly. Did I say I want to meet monthly? I meant I wanted to meet monthly if I said quarterly, not quarterly. And yes, I think it would be great to have a chair of that and setting up goals, and then bringing the work being done or any information, or even calling for help from the larger COC body, and inviting anybody who wants to become a voting member of the Continuum of Care as a whole that is on the permanent or on the supportive housing committee, inviting them to do so as well. I'd like to see us meet monthly.
Okay, thank you.
You're welcome. And I would be happy to chair it if that's a need as well. And I know that there's quite a few people who are on the call from that committee. Do you guys have any suggestions or any input on how you'd like to see that? I mean, not getting into too much, but you know, starting point.
This is Becky. I'd just like to learn a little bit more about what the role of this task force has been historically, and going forward, what the responsibility of this task force is, so that I could learn more about how the subcommittee could fit under the COC.
Are you talking about the Continuum of Care group, Becky Gross?
Yeah, just kind of learn more about what is its role in the community, a little bit about where it's come from, what the goals are, what does the structure of the attendees look like.
Absolutely, and I can talk to Kyle and see if there's anything that may already be put together, or if I can put some information together for you and other members of the supportive housing committee, so that you guys can learn more about it, because really you guys are doing a lot of the same work that we're doing. So I'd be happy to get that information out to you.
Melissa, this is Chelsea. I just want to point out that Karen Hayes has a comment in the chat box, and it says, I'd like to understand gaps and needs in an effort to learn how Cadillac and Providence may be able to assist. I just wanted to point that out.
Thank you, Chelsea, and thank you, Karen.
Of course.
But basically, Melissa, isn't the Continuum of Care group charged with understanding the homelessness needs in our Benton and Franklin counties and coming up with a plan to address it? Is, in a nutshell, is that the majority of the work of the COC, or did I get part of it right?
No, you did. You absolutely did, Carol. So it's a federal mandate for some of the funding that we receive from HUD, and even some state funding as well, that each county, and ours is a bi-county continuum of care. On a community level, we're assessing the needs of the homeless population and what we can do with our resources, or what resources we want to prioritize and populations to address those needs, with the overall arching goal of ending homelessness in our community.
Thank you.
You're welcome. And I believe we just finished working on our updated homeless plan for our counties. We're waiting to hear back from Commerce on that. And then once that is approved, I'm sure that we'll be able to get that out to the group as well. Okay, so moving on to old business. I unfortunately was not at the last meeting, so I'm not sure what old business is hanging out there, but if there's anything that the group would like to talk about, feel free to bring it up.
Yeah, hi, this is Kyle, and I think the only thing, and I don't know that we need to address it right now. I was not at the last meeting of last year, and so typically what we do at the end of the 2-year run, that was the end of our 2-year run with regard to our officers, and so typically that's something that is addressed at that point. I know we brought it up at the earlier meeting this year. It just is something to be thinking about. Again, I think it's maybe, I don't know that it's something we need to address right now. But I know, Melissa, you and I have talked about whether or not you were interested in continuing this chair, if there's anybody else who's interested in it. But I think at some point we need to at least formalize it in a vote. And again, like I said, for everyone included in this email, I can certainly send out the bylaws for the COC, and then maybe that can be some scheduled business at the next meeting, is that we address it, whether or not we continue. I think, Melissa, you're chair, and I think Jeff is co-chair, or I don't, the second chair. And so, if you guys are interested in continuing, that would be great. If there's other people who are interested in stepping up and taking that role, we can certainly have a conversation about that. But then my hope is at the next meeting, we at least make a vote and formalize it.
This is Becky, would it be possible to see the plan? You mentioned that there's a new homeless plan that's being vetted. Is there the previous plan? Is that something that we could see?
Yeah, we can certainly send you the old plan. We can send you the current one. It just hasn't been signed off on by Commerce yet. Okay. So it's still it's not in draft form, but it hasn't been approved yet. And so I think that was something that was supposed to happen this last month, but like everyone else, things kind of got knocked out of whack here a little bit because of the health crisis that we're all dealing with. So I haven't heard, they haven't communicated to us when they plan on on getting to that. I imagine, it'll be sometime later this year. But we can certainly send out the plan. That's not a problem, just as long as everyone understands that that's not something that's been approved yet by Commerce.
I think that would be really helpful.
Okay. Yeah. So then I'll send out to everyone, and I think Carol, I know you forwarded the invite to the Supportive Housing Committee. I don't know that I have that list. So if you could forward that to me, I can make sure that everyone, both on our COC email list and the Supportive Housing Committee list, we can send, again, the bylaws for the COC, and then the draft of the 5-year plan.
We can do that. Thank you, Kyle.
You bet.
Thank you, Kyle. And I don't know if this is old business or maybe, as you mentioned, maybe something else to put on the agenda for next meeting. The point in time count, how did that go?
The point in time count went well. We had great volunteers. Again, we don't have official numbers yet. Mari, when typically does that happen?
I know, I looked yesterday, 2 days ago, and they haven't been posted as of then.
Yeah, and so Mari, we can certainly include the website too, and how to, anyone can access that information. We can put a link in when we send this out as to how everyone can do that, but we don't have official numbers yet. I think usually, Mari said she just checked a couple of days ago, and there was still nothing official. I think usually we could expect it about this time, but that all of this stuff might get pushed off. So hopefully in the next month or two, we'll get the official numbers.
And so unofficially, do you think you see that, or the volunteers, or did it seem like there were more or less, or just nothing like really striking? I know not officially, but I'm just curious.
I don't have any numbers right in front of me. I know, again, I think the point in time count is a useful tool. It does have its flaws. It's one time, one day out of the year, and it's in the middle of the winter. And so I think whether this year was a little more gentle than it had been in the last couple of years. But I know, there were, typically we'll find people in like Peanuts Park in Pasco, and I don't find anybody there. But I don't, I don't have numbers in front of me, so I don't even want to speculate. But I know there have been people that we've seen through coordinated entry that were on the pick count that we got housed. Obviously they'll take a priority. And so, I think I think there's even progress that's been made, since the count.
Thank you, Kyle. And I didn't mean to put you on the spot or anything. And so I appreciate the information that you shared with us, definitely. And it's good that there were volunteers there, because that's important.
Yeah. Yeah, the volunteers were great. I again, for any of the agencies out there that allowed staff to come and volunteer and help, it's very much appreciated. They were great.
We had about 30 volunteers.
Yeah, we had about 30 volunteers. So it's we can't do it without volunteer help.
Wow, that's awesome. Good job. Okay, so is there any other old business? / we think it might be old business? Okay, so I'm going to go ahead and move on to the member updates. We're going to try to keep our responses to about 3 minutes. So Kyle, if you'd like to start us out on that.
Yeah, and so just kind of a response from the state's assistance for the counties in combating the COVID-19 illness with regard to our homeless population. There were dollars that Commerce had distributed to both Benton and Franklin counties, specifically for developing resources, quarantine and isolation resources for individuals that have tested positive, have symptoms consistent with, or have been displaced as a result of the COVID-19. And so we had went into contract with a local hotel and blocked out rooms for quarantine, for the quarantine rooms for our homeless population. We've received referrals from our local hospitals in both Benton and Franklin counties. We've got for example, when a hospital gives us a call and they've got somebody a homeless individual that has a positive test or has symptoms consistent and they're waiting test results, they'll coordinate with my staff. We'll provide transportation. We've got a contract with a taxi company that will pick them up from the hospital. We'll transport them to the door at the hotel. There's meals provided. The taxi company has wheelchair capabilities and prescription medication drop-off capabilities. We've got youth beds contracted with My Friend's Place for youth, homeless youth that are needing quarantine. The plan we'd worked with in developing with the health department, and they were great. They help provide us with data, and so that's kind of what we're doing from the county's perspective. On a side note, not necessarily in line with the quarantine beds. Again, just so everybody knows, we've continued to screen with coordinated entry on our screening days, Tuesdays, Wednesdays, and Thursdays. We're doing of course, the county's closed. Closed in response to the public, but the health department is not open, but we screen over the phone. And then for the people that need essential needs, we've got one day of the week that staff, they'll call staff when they get to the door, and staff will bring down the essential needs that they need. So that's all for my report.
Thank you, Kyle.
Hey, Kyle, this has been Shearer from Pasco Fire.
Yeah, I've been.
Any kind of numbers on how many people you would have housed in that project?
We haven't had a lot. We've had some people that have. I don't have numbers for you. It hasn't been a huge use yet. I know we've had a few people that have positive tests, and then we had one individual who was at risk. He'd been staying over in the Mission. He had to have emergency surgery, and there was some concern about him returning back to the Mission. And so we quarantined him, and he's actually somebody that once he got done with the quarantining, we screened him for a housing program, and he's eligible for housing assistance. And so we're gonna put him into one of our programs, put him on a housing search.
That's awesome. Is there any way I don't know if you guys kept track of numbers by counties, residents, or anything?
Yeah, we could probably come up. We have numbers. I don't have them sitting in front of me.
No, that's fine.
But yeah, that's something that we can, again, that we hope to be able to do. These dollars are a little bit different. Most all of our dollars we have to account for in the HMIS system, Homeless Management Information System. Commerce is a little more flexible with these dollars. However, we still wanted to keep track of them too. We wanted to know, what if they were living in a car, were they at the Mission, were they, what their circumstances were prior to going to the hospital. And so we developed a screening tool that just has very basic information on it, just more for our internal data collecting, so that, you know, when we're all done with this, you know, kind of hopefully we'll paint a picture as to, you know, in the event that we're in a situation like this again. Hopefully we won't be, but we've got the beds contracted at least through September, and so, you know, we've got resources to get us through the summer, and hopefully some of this will start dying down by then.
That's great. Yeah, that's what I was thinking. If we had any kind of those numbers that we could use for next time around, in planning and, you know, for down the road future programs and stuff, that'd be awesome if we could get those.
Yeah, we how we kind of based the number on what we needed. We, you know, sat down with the health department, and they helped us come up with, you know, again, and that's the trick, is trying to project what the need is, and you know, even, you know, again, I think all the health parameters that have been put in place have done a good job in limiting the impact, but obviously we all got to get back to it at some point, and so I anticipate we'll see an uptick, you know, once we start returning to business. So it'll be, you know, we're hoping to kind of keep tabs on all of that stuff, and you know, at the end we have some numbers that we can use to justify, you know, what our need is, and, you know, if ever in this situation again.
Yeah, that'd be appreciated. Thank you.
Yeah.
Kyle, this is Carol. I was wondering if we are seeing the kind of outbreaks through the Union Gospel Mission like they're experiencing in Seattle.
I think Charis has been great, and I think she's on the line. She can probably comment. I think to my understanding, and maybe last time I spoke with Charis, they didn't have any cases yet. But again, I think Charis has done a good job of keeping things tight there. And again, one of the individuals that we put in the isolation bed, although he didn't have a positive test, he had gone over to the hospital for emergency surgery, and so there was some concern about him coming back from the hospital and potentially, you know, what he might bring back with that. And so, you know, I don't know, Charis, if you're on the line, maybe you can comment on that. Like I said, I think she's been doing a pretty good job over there.
Thank you very much. I appreciate that. Can you guys hear me okay?
Yeah, you sound good.
Awesome. Yeah, we have no positive cases in either the women and children shelter nor the men's shelter either. We currently have only women staying at our shelter, at the women's and children's shelter. We have no children. Prior to going into our lockdown state, we tried to get those who were extremely vulnerable, either placed with family or friends, those who had children, getting them to a place where they had access to a yard, making sure that they were as comfortable as possible. We are currently not doing intakes, but I've tried to keep Kyle informed. We, on a regular basis, probably once or twice a month, are on an active phone call with the CDC, making sure that we're in compliance with, and we're also talking with the other homeless shelters. I have current intake processes from the homeless shelters in New York and in San Francisco to kind of create our own process so that we can safely get people in our facility while not exposing our vulnerable population.
Thank you.
Thank you, Charis, for sharing that with us. So I had one question about Kyle, the program, that do they put a limitation on how long people can stay, or do they give them a chance? Does the program allow them like a chance to, you know, generally you hear like that hard, fast 14 days and you should be done with the COVID.
Yeah, no, an example of that is we have a woman in one of our quarantine beds that, when is she up? She tested this week. Yeah, and so she had a positive test. She got sent over from one of our hospitals. I think she was supposed to be retested this week. She was living in her car before coming in, so she's not some, you know, we're going to put her in a program. She's not somebody that we're going to, you know, discharge back to her car. And so, you know, so the short answer is that the recommendation is that they remain there for 14 days, and have a, you know, and again, once get retested, have a negative test. But we have extended it just to try and get them into a program, not to, you know, if we don't have to, you know, send the person back to the mission, you know, if we can just enter them into a program, you know, then that's what we want to do.
Thank
So,
you.
Melissa, this is Carol again. I'm sorry, I have so many questions. I know that there's been a lot of money that's been coming through the Department of Commerce, and Kyle, I think I remember reading that the Department of Human Services of Benton and Franklin counties received about $700,000, and that's what you did with your contract with the hospital to get some quarantine beds for homeless individuals. But I'm wondering if anybody else from the Continuum of Care or our housing family has applied for any housing grant through the Department of Commerce to build capacity for homeless individuals, or was Benton Franklin, the Human Services, the only one that applied for those funds?
Well, and that those, just a point of clarification, I think the COVID dollars, that wasn't something that was applied. We didn't apply for those. The Commerce reached out to us and provided those dollars specific for quarantine. The article in the paper in the Herald actually was wrong. You know, I always get a kick out of when they quote me when I didn't even have a conversation with them. But the dollars were specific for quarantine and isolation for our homeless population. And so, you know, my office got calls from people just wanting a hotel voucher because they were, you know, living with their sister, you know, which that's not what those dollars were for. And so I think in terms of building capacity, I think that's the kind of the long-term goal is that our community needs to add units. But that's not what these dollars were for. These dollars were specific for quarantining.
Okay, thank you.
And Kyle, this is Raquel with Senator Murray's. I popped back on. It was CBDG grant money specifically allocated for homeless and housing under COVID-19.
We're talking about two different dollar amounts, or two different funding sources. The funding that we're talking about was different than the CDBG funds. We did get CDBG funds that we'll be routing through CAC. They're our contracted provider, and so I can, maybe Melissa can talk a little bit more about you know, what they'll do with that. I think typically they do, you know, again, I don't know how that'll work now. I think they you know, typically we'll have town hall meetings and determine how to use those funds based off of what the community identifies. I wasn't talking about the CDBG funds. I was talking about the dollars specific for the counties. When the county didn't elect, if the county didn't elect to use the dollars, then the dollars went to the CHG lead. In our case, we are the CHG lead for both counties.
So this is Melissa. I just wanted to update everybody of what CAC is doing. That Kyle mentioned the CDBG funding to assist the individuals that are living in the non-entitlement areas of Benton and Franklin counties. So that's more of your Connell, Benton City, West Richland, Prosser, to help meet their needs. That we're looking at, we're exploring our options a little bit, that we know that we want to assist with some public services. So emergency rental assistance, emergency utility assistance, transportation, but we're also exploring different options for micro enterprise assistance in the rural areas too. So reaching out to different people out in the rural areas, Prosser, Tridec, so that we could see if they have a feel on what the needs are for. It's approximately, I want to say 78,000 is what the award amount was. So more details to come soon on that, on exactly what our plan is going to be. What else? So we've also, and the cities might be able to update as well when we get later to their CDBG dollars. But a lot of what we're doing has to do with just how we're operating and doing business, that we want to continue to meet the need, but we have to do so in a different way. So unfortunately, you know, we can't leave our doors wide open for people just to stop by anymore, that we're giving a lot of direction on calling or emailing. We're setting up systems to be able to video conference with participants, to be able to do our case management. We've installed Dropbox that's locked so that people can come and drop off paperwork such as their LIHEAP documentation. We did receive an increase in our LIHEAP dollars, which is our low income home energy assistance program. So, you know, we've got to be able to still serve people without, while keeping all of us safe. I'm trying to think what else that was a lot though, just kind of being on top of best practices and how do we still, and I'm sure it's things that everybody on the call is going through, but how do we do what we do and still meet the need that's growing because of this, but do it to where we're keeping everybody safe. So yeah, I think, and I did apply for one of the national grants that came out. I think they had like a 2-day turnaround for the impact grant. I don't know if anybody else did that. It was short and sweet, but I think the response that they got back was that I received back was they only funded 16 applications out of like 2,000 submissions or something. So I didn't feel too bad when I didn't get that one, because that was some pretty hardcore competition. That's all that I have to update. So are there any other people on the call that kind of want to update what they're doing?
So this is Lona. Hi, this is Lona at Kennewick Housing Authority.
Hi, Lona.
Hi. We are still processing applications. We're still issuing vouchers. We have changed and we're doing all of our business by email, mail service, Dropbox, telephone. We are not doing inspections except for initial inspections on vacant units and on a case-by-case basis to get someone leased up in their existing unit, say a new VASH voucher ported to our community. We would, staff would gear up in PPE and do that inspection. But we are doing that. We are still actively completing annuals and prioritizing changes in circumstance due to loss of income, due to loss of employment. So we are working. We're working kind of a separate schedule with some folks coming in Mondays and Thursdays, some coming in Mondays and Wednesdays, some coming in Tuesdays and Thursdays. And we're socially distancing and looking at how we can continue to lease individuals up and keep staff safe. We have also initiated a new preferences that have been approved, which will allow us to take referrals from the Housing Resource Center here shortly. So I think that will help with getting some homeless individuals housed. So we're looking at getting that off the ground in 2 or 3 weeks. We have not applied for any grant funding coming in yet on the there was some nonprofit money that we applied for, really didn't think it fit well, and we should let the small businesses go for that. But it appears that HUD may be providing additional funding for public housing authorities, and hopefully we'll get some additional vouchers to serve families. So that's where we're at.
Lona, this is Carol, have you seen an uptick on people applying for low-income housing because of COVID?
Our Section 8 list currently is closed, so we have, on our other programs, we have not seen a big uptick. We have not seen as many changes of circumstances that we thought we'd see, and I don't know if folks are just slow or whether they're getting unemployment and they just haven't reported yet or not. We're seeing less impact than we thought in terms of rent for April. We expected a big downturn in people paying their rents, and we didn't see that. So I was really pretty proud that we didn't see any more uptick in rents. We did see a substantial uptick on people not paying their rents at the tax credit property. So that was kind of surprising.
Thanks, Lona.
This is Tabaski of Ansel. Can y'all hear me okay?
Yep, we can hear you, Tabaski.
Awesome. All right, so we haven't had any of our program participants sick, and nobody obviously tested positive for COVID, so that's a good thing. As far as what we're doing for the community, we've been shut down because AARP was our provided the employers for us to keep our service center open, where we provided the free showers and laundry services and bathrooms for individuals. So I was finally able to get some dedicated volunteers, and we've come up with procedures to be able to make sure everybody remains safe. So starting next Monday, we're going to offer our showers and laundry services once again for 3 days a week. And as we get more volunteers, dedicated volunteers on board, we'll be able to get those, keep the doors open a little bit longer and possibly on the weekend. So right now it's just for 3 days out of the week, Monday, Tuesday, and Thursday, just based off availability. And then for 9 hours. If you go to our website, if everybody can write this down, www.ansil99336.com. And right on the front page, we have our appointment schedule. So for people that are working, if they typically haven't been able to get in during our walk-in times, we've created an appointment schedule to where they can select a slot, and one of our volunteers has offered to be on board to come in whenever they needed that, between the hours of 7 a.m. and 7 p.m. and open up the showers for them to come in and take showers or do laundry. So those are the services that we have for the general public here at Ansel.
Thanks, Tabaski.
You're welcome.
This is Anna from SSCF. Due to the current state that everybody's in, our program has changed a lot for the next 3 months. And if you do have any veterans that do not have a dishonorable discharge, if you have them contact us, we may be able to help house them sooner with less barriers. My phone number is 509-845-2227. And John, if you could state your phone number.
509-460-2606. And just to kind of add on to what Anna was saying, not to cut her off or anything, but we're also, if for those qualified veterans, if we can get them enrolled, we can also throw them in a hotel, you know, just to get them off the streets while we work on that housing plan.
Awesome, thank you.
Hi, this is Karina with Communities and Schools. We've been still working, so we're still connecting with the districts and the families that we were working with prior to the closure. I mean, obviously it's looking a little different. Check-ins are more on phone as well as emails, but we're also doing porch drop-offs for essential items. So if a family contacts us and needs food and hygiene, we've got a number of donations that's helped us get those items to the family. We've also received some donations by gift cards that we've been able to get to families as well. We are trying to just support the districts as much as possible, so it's not just families that are in our CIS schools. So if the school districts contact us and have an additional family they need us to reach out to, we have been. Our contact information should be on all the district sites now, as well as there's a link on our website if a family even wants to reach out to us directly and had questions. And then we've also had an increase in being able to use the funds that we received from Greater Columbia in partnership with Safe Harbor, which is a one-time $500 support to help with rent or utilities like the PUD, water, or gas. And so we've been making more referrals over there to kind of, 500 doesn't go very far, but it's helping the supplement for some of the families that are getting behind, which has been great.
Thank you, Karina.
You want to hear anything from Columbia Industries? Yeah, we're very new to this group. I'm Justin Kroom, by the way, Director of Mission Services. Very new to this group. Kyle invited us to join in because we were inquiring to him and Mari about where we could find some community partners to help solve just what we're seeing in the problems with housing locally. Traditionally, Columbia Industries has a long history of helping persons with disabilities, but in recent years, we've also been opening up to the other populations with other barriers to employment and helping them with vocational training and also wraparound services and placement. And one of the things we've been experiencing that we've been looking for a solution for has been housing, and those basic needs. So that's really heightened our interest, and we weren't really finding them in the community partners. So we just really am glad to get acquainted with all you folks. Recently, we've also, because of in the COVID crisis, we've changed tack somewhat on some of our programs and really pivoted a couple of them. Some of our staff who are not able to spend as many hours as they have in the past directly in employment services and other areas and other programs, we have turned into focusing on, especially one of our staff is experienced in homeless outreach. In fact, she worked for a year in Wenatchee with homeless outreach. And so she's helping us develop a program under Medicaid and Foundation Community Supports. And we're looking at developing a position. In fact, she's already kind of starting at it, that we could consider her to be a landlord liaison. And so she can help find some, at least that seems like to be the shortest path right now for our program development, so that we can contact existing landlords and help some of our participants in the FCS program and find them some places to stay. So that's kind of our early venture into this at this point. And because we're not able to focus on some areas as much as we like, we're focusing on that program development right now. And so, yes, and if part of that too that we're doing right now is that in our vocational training for food service, we've pivoted that in response to the crisis too, and have been some of the homeless shelters locally. I believe Ansel, Toboski, I think you've been getting some meals from us from our kitchen. But if you're aware of other urgent needs in that same way in some of your locations or supports, please let us know, because we're trying to look at that as an output for right now, because we realize that some people just can't or shouldn't go out as much. And if we can deliver some food, that's great. So yeah, this is just a really early dipping the toes in the water with you folks and seeing what we can do and learn from it. So yeah, again, I'm looking forward to your email, Kyle, on some of the background to this group, so we can figure out how we can best be a support and participate. So that's just our early toes in the water.
Hey, Justin, this is Carol Moser from Greater Columbia. So I had heard last week at Rotary that Meals and Wheels is really suffering because they've lost most of their volunteers that can do community outreach and deliver meals to the seniors. So I don't know if you would like for me to get in contact, or if you've already been in contact with Meals for Wheels, Meals on Wheels, excuse me, that might be a good partnership too, but you might already be contacting them.
We actually share a kitchen with one of their distribution centers down there at the park down in the city of Kennewick. So I'm not aware of it sounds like it's probably with their distribution that they're working on. And I don't know if we have much we can help them with distribution, but you know, if you're aware of anything, don't feel free to call, you know. Yeah, that's a good question. Thank you.
Thank you.
And Justin, this is Melissa from the CAC. I just wanted to say welcome. You are among friends, and thank you for sharing.
You're welcome. Also aboard, I think, is Judy Campbell. She's the manager of that's serving that FCS contract, and I think she's here. But Jessica Sagdahl, she's the one that's going to be hands-on heading up that effort with the program development.
Wonderful, and thank you.
Yes, I'm here, Judy Campbell. We're looking forward to reaching out to the homeless. We're working with employment services through FCS right now, and we're also, like Justin said, getting housing started up and wading through it. Fortunately, Jessica has quite a bit of experience, so we're looking forward to her making contacts. I'm making a list of contacts today, as a matter of fact, so we should be up and ready to go.
Sorry, I have a problem with my mic button sometimes, but thank you, Judy. We're glad that you're here too.
Judy and Justin, I'm Becky. I'm with Consistent Care, and we also are foundational community support providers. So happy to help you in any way as you build that program. I do that in all my areas, as well as we also have a GOSH contract right now where we're going to be housing folks coming out of Eastern, Western State Hospital, Eastern, as well as any other inpatient psych unit that qualifies for services. So happy to help you. Just reach out.
Well, thank you. Do you have a contact number?
Sure. My email is becky@consistentcare.org. Pretty easy. And my cell, 509-528-4738.
Perfect. Thank you.
You're welcome.
Awesome. Thank you, Becky.
You bet.
So this is Karen Hayes with CADLIC, and I just wanted to share that the CADLIC Community Health Improvement Plan has been approved by our board, and it should be up on our CADLIC and Providence website by May 15th. And related to homelessness and housing, of course, our goal is to work with others to reduce homelessness. And one of the ways that we planned on doing that was by hosting an in-person workshop to help determine what the needs are and any potential ways that Cadlick and or Providence can help. So I was really hoping to be able to utilize this call and maybe some follow-up by email in ways that Cadlick might be able to help your agencies moving forward with housing and homelessness, since I don't think we're going to be meeting in person anytime soon. And one of the strategies that we're going to be looking at, Providence is looking at for the Montana, Washington region, is if the Built for Zero model could be helpful in our area. And also Providence has implemented a couple of pilot sites that are planned. Well, I don't think they have implemented again due to COVID, but planning to pilot some social determinants of health platforms within EPIC, which is the electronic medical record. So those things are on the horizon, hopefully. That's it for me. Thank you. Anything that you would like to email me with gaps and needs, I would appreciate your email. Thank you.
This is Becky. I just have a question for Charis. Charis, hopefully she's still on. Yeah, I see her. Are you guys still meeting on the medical respite beds?
Yes, I believe Susan Campbell is on the line as well, and I can let her lead on that one if you would. Susan, are you there? Maybe she's not. So yes, we're still meeting on that. We haven't met since COVID issue, but yeah, we've been meeting on that. Right now, we're just looking for a funding source. As many of you guys know, we don't need funding sources. We're currently looking on that to get a nurse full-time in our facility, and that will be kind of the final barrier we have to start opening up beds. So I know that we're in partnership with Grace Clinic, and our executive director has been meeting and looking for funding sources. So hopefully that answers it. Does it answer it?
I'm sorry, this is Raquel with Senator Murray's office, and I really didn't hear any of that. It was very muffled and garbled. Could you repeat yourself, please?
Yes. Can you hear me now okay?
Much better.
Okay, sorry. I have multiple people in my office. We're social distanced. I will let you know. But we are looking to hire a full-time nurse right now. That's all we need to start implementation. We have the beds, we have all the other things in place, but we need a full-time nurse manager. So we're looking for a funding source for that. As you know, we don't usually do government grants, so we're looking for a private source for that. So that's where we are with the respite beds at this time.
Thank you. I assume Karen is at the table having those discussions with you.
Absolutely. Although I miss your face, Karen.
Yeah, not today. Thank you.
Is there anybody else who'd like to give us an update on how you're responding to COVID?
Yes, I wanted to give an update for Community Health Plan of Washington. This is Katie Zorb calling. I'm a community health worker in the Greater Columbia region, and just like all other agencies, we've had to transition from doing a lot of in-person work to kind of trying to figure out how we can offer our services over the phone. One thing in particular that Community Health Plan of Washington has implemented is a meal delivery program for our very vulnerable and need Medicaid members. And that's something that's completely free, and that usually gives one individual about 14 days worth of meals, 2 weeks worth of meals. And that's something that it's very low barrier. But the other thing that we have done, along with, I know a lot of the other managed care organizations have done, is really stepped forward and make sure that all of the providers in the Greater Columbia region have the equipment and tools that they need to do their job. Healthcare Authority has been helping with some providers that haven't had enough equipment for all of their employees. So Healthcare Authority has been giving donating the equipment, and we at CHPW, we've been making sure that all of those providers have the information they need, excuse me. And then we're also trying to come up with some trainings to help providers do telehealth, because a lot of providers haven't done that before, so that is a very big transition. And that was the only update for CHPW for now. The one question that I did have for the COC was, I wanted to clarify how the Housing Resource Center is screening clients right now.
Hi, this is Mari. Right now, currently, anyone can call our housing resource number, and the phones are dispatched to our staff out of the office, and they're doing screenings over the phone. And so they're still kind of doing it the same. They do the same screening over the phone, and then they triage like they normally do once during the week. And so then they'll contact the individuals that we have programs for after that once they triage. So they just aren't collecting all the paperwork like normal until it's safe to do so, but screening is just the same process.
Okay, great. And if a voice message is left, if there's no answer, if someone calls, do the screeners check that and call back, or is it best just to try again?
They can always leave a message, but they could always check back as well.
Right. Okay. I know everyone's very busy. Thank you, Mari.
Uh-huh.
So Melissa,
go ahead.
Well, and I could talk a little bit about what Greater Columbia has been doing to help out during the COVID crisis. So the first thing that we did is that we created a list of resources, really kind of more like state agency resources, the Healthcare Authority, DBHR, DSHS, on our website. So if you go to our website, Greater Columbia ACH or gcach.org, you'll find a list of resources that's pretty comprehensive. The second thing that we did is that we sent out a survey to our behavioral health, mental health providers, asking them what they needed during this time with regard to telehealth. And given that survey, we funded all 17 of our behavioral health providers, and we also funded our community action agencies, so CAC, Hope Source, were some of the recipients of that telehealth funding. And what that did is provided them with $6,000 to purchase laptops or iPads or software so that they could do telehealth or teleconferencing for their individual organizations. We also funded $300,000 went to Second Harvest. That was a couple of weeks ago. We found out that they needed, their food supplies were running really low. So the board of directors voted to donate $300,000 so that they could stock the 45 food banks that are in the Greater Columbia ACH region. We met a couple of weeks ago, I guess, was our leadership council meeting. And at that meeting, I think Melissa, you participated. Thank you, Melissa. To find out what is happening across our 9-county region. I think we're all in a state of not knowing what everybody else is doing and all getting hit with the need for resources and funding. So it was very helpful to find out how our communities had responded to the COVID crisis. Some of our smallest communities have been doing innovative things, which is really exciting. Like providing transportation and food and masks and PPE and that sort of thing. We're currently working on trying to figure out what the funding formula is for the CARES Act. We know that our region, our GCSH region, is one of the hardest hit regions in terms of rates and deaths. And we want to ensure that the region receives the necessary resources during this time. Can you guys, any of my GCACH folks, can you think of anything else that we've done for the COVID crisis that I should add?
I don't know if you mentioned, Carol, but we also pushed money out not just to the behavioral health agencies, but also to community action agencies for telehealth infrastructure.
Thanks, Wes.
So I was a recipient of some of that money for the telehealth. So what we've done with that is we purchased tablets, and that's going to help facilitate more face-to-face. So we've started doing a lot of telephonic work where normally we put people in our cars and drive them around town to, so this has been very challenging for us, but it's going to allow us to continue to do things like supportive employment, supportive housing, where that face-to-face is really helpful. And so we ordered tablets, and we're going to be in a actually they came, we're waiting for the covers right now, be able to pull up at someone's house, hand them a disinfected tablet and sit in our car. So we will have data on these tablets, and then we're going to set up teams and hook it up before we hand it to them, so then we can see them face to face from our car, and then have a disinfecting process to receive the tablet back. So we're looking forward to that. We're also looking for emergency rooms that might be open to having a tablet in their ER. We're going to place it in other places so that folks can just Teams us. We're going to have each tablet will have its own user account, so then we'll be able to communicate face to face where we obviously can't now. So
great, that's good. Thanks for sharing that, Becky.
Yeah, thank you.
Hey, Carol, this is Martin. I don't know if you talked about also the skilled nursing facilities, the ones that we have contracted with, and how we, also gave them some things that they can use with their residents.
Thanks, Martin. Yeah, we're starting kind of a fun, it's called a care packages, because during this time, with social distancing or physical distancing, it's really hard for people that are isolated, especially those in long-term care facilities. So we're offering packages, which also includes the video capability, but also some fun things like, the beach party or the 50s diner, something that will give the activities director a way to work with the residents during this time. But they're pretty isolated. And I think it was Prestige Care that ordered the tic-tac-toe or the beach party. So we're hoping that it can expand and spread. Right now, we're just working with the 3 skilled nursing facilities that we're contracted with, but we hope to expand that program.
Carol, in addition to that, this is Sam. We also have provided technical assistance for policies and protocols into a crisis response system.
Thank you, Sam.
You're welcome. So this is Raquel with Senator Murray's office, and we have been diligently busy on the CARES Act and stimulus funding. And you probably saw over the last week, CARES Act 3.5 hit and is being circulated out now this week. We are preparing ourselves to gather information for stimulus 4, So anything and everything is open for discussion, and variations between housing, higher education, workforce development training, transportation, isolation issues, you name it, it's on the table right now. And so we're collecting stories, information, anything from the region. So if you don't happen to have my work cell phone number or my email address, if Melissa or Carol, if one of them would gently send that around, that would be super awesome. The desk number you can reach me at is 509-453-7462, and my cell phone number is 509-654-6684. And here to listen and learn. And we've been stimulating out the CBDG money, the FEMSA money just hit for mental health. Yakima Region Comprehensive received some funds. The housing authorities received some funds, so we hope to get some more vouchers out. And Lana, you're on my mind, and hope to talk with you all soon.
And thank
Terrific.
you, Raquel. Thank you, Senator Murray, for all that they have done and you guys have done for the state of Washington.
Thank you, Carol. We'll keep working.
Thank you, Raquel. This is Lana.
I do want to really quick here, since I do apologize taking up a little extra time. Agriculture workers are on our mind with H2A housing, so and the incidences of increased agricultural workers being identified with COVA, and that also goes into the retail workers to the groceries. So those are on our minds right now, and there's lots more things that are also on our minds in Senator Murray's shop, but happy to listen and glean from the experts in the room, or actually on the phone.
Thank you, Raquel. So it looks like in the chat box, Kathy Jones from, oh, I always get this wrong, City of Pasco, Franklin County Housing Authorities, something like that, but Housing Authority in Pasco. I apologize for butchering the name, Kathy. Her update says we've had quite a few changes of circumstance reporting due to job loss. We're also operating as Lona described, not open to the public, and use phone, email, mail, and Dropbox. They had to go back to work full-time to keep up, and they're continuing to lease up any empty units. Thank you for that, Kathy. Any other updates that anyone wants to share?
This is Michelle Burden with the City of Richland.
Hi, Michelle.
Hi, I wanted to share our updates. The City of Richland received an allocation under the CARES Act CDBG CFI funds of approximately $179,000. And we are going to use our funds to assist small business stabilization for retaining and creating low mod income jobs. It's a short-term program for operating costs. We also plan on for the low mod individuals and families in Richland, as well as assisting Meals on Wheels to fill the gap of approximately $129,000 that I understand they have a shortfall for Richland residents, senior citizens. So those are a few things that we're planning on doing. The Home Investment Partnerships Program funding didn't provide any additional funding, but they did relax some of the rules and regulations and provided some waivers. So we're looking into an emergency short-term tenant-based rental assistance program, as well as a regular tenant-based rental assistance program. So we're working on those type things.
Thank you, Michelle.
Melissa, this is Lona. This is not COVID related, but just wanted to give everybody an update. The microhomes project is moving forward as planned. We may have a month or two delay, but we still anticipate having housing for the homeless, hopefully by Christmas.
Yay, how exciting, Lona.
That's my Christmas present, Lona.
Hey, this is Kyle. This is Kyle. Just one other thing. I'm sorry, I forgot to add. Prior to the stay-at-home order, we had been working on meeting with our steering committees for the 2060 fund, and so we put some of that on hold, hoping that we could kind of get the ball rolling on that again. I think what we'll probably do is send out emails to the steering committees and identify identify how much funding they would like to release, and then hopefully in the next month or two we can get an RFP out for both counties. So anyway, that was something I think that we talked about at the last COC meeting, that was coming, but that was one of the things that got put on hold. So we're still looking at doing that. We just got to sort through some of the particulars first, but that should be coming up soon.
This is Alicia with the City of Kennewick. Can you hear me?
Hi, Alicia. We can hear you.
Okay. I'm going to have to get off. I've actually got a meeting right after this, but the City of Kennewick also received money through the CARES Act, approximately $400,000, and we are also looking at a combination of small business loans and public service agencies, and that actually hasn't been completely decided yet. In fact, I have a meeting in about 3 minutes regarding that, but just wanted to let you know, similar kind of to what Richland is doing.
Thank you for the update, Alicia. We appreciate that. Good luck at your meeting in 3 minutes.
Thanks.
Are there any other updates? I don't know, guys. I don't think I've ever ended a meeting on time. It's a little weird. Okay, well, thank you all for joining us today. This really worked out really well. That I was a little nervous. First time COC go-to meeting that I'm aware of on our county level. But I really enjoyed it, and I'm glad that all of you guys were here and provided us so much useful information. Our next meeting is Wednesday, July 29th at 3 p.m. in the Cedar Room at the Benton Franklin Health District building. For supportive housing committee members, I will be in contact with you most definitely before that, so that we can work on establishing what we want to see. What do you guys want to see your group to be for, like, as part of our COC? So any other questions, concerns? Okay, so everybody get out 2 minutes early. Somebody, Betsy, you might want to put this down on the calendar, because I don't know that I've ever ended the meeting early before. And everybody have a good week and stay safe.
Thanks, Melissa.
Thanks, Melissa. Stay safe, be healthy.
Thank you all.
Good job, Melissa.
Yeah. Thank you all. Good to make the acquaintance.
Thank